Rural communities are wonderful places to live and work, which is why nearly 62 million people, nearly 1 in 5 Americans, call them home. This is the story of the Healthcare Collaborative of rural Missouri. Our small towns and farming communities are places where neighbors know each other, listen to each other, respect each other, and work together to benefit the greater good. They are also some of the best places to start a business and test your entrepreneurial spirit. These communities provide the rest of the country with a wealth of services and commodities, and they are the economic engine that has helped the United States become a world economic power. Our rural communities also have unique healthcare needs. Today, more than ever, our rural communities must address accessibility issues, a lack of healthcare providers, the needs of an aging population suffering from a greater number of chronic conditions, and larger percentages of and underinsured citizens. Rural hospitals, which are often the economic foundation of their communities, in addition to being the primary providers of care, struggle daily as federal reimbursement rates decline. These disproportionate funding levels make it challenging to serve rural people. To be successful in rural healthcare, we found it to be critical to create strategic partnerships in the provision of services.
So HCC is definitely a network first. We developed the federally qualified health centers after the network was already developed. And really, the network activities encompass all of the social service aspects of serving rural communities, specifically low income, poverty, people living in poverty, people that are experiencing different levels of social determinants of health. We try to capture that and address those issues. So we're focusing on the whole person, not just their healthcare needs.
The Healthcare Collaborative of rural Missouri and its 4 LiveWell community health centers have stepped up to these challenges by making patient care affordable and accessible. HCC services include primary medical care, oral health care, laboratory services, health screenings, immunizations, family planning, well child services, women's health services, prenatal and postpartum care, substance abuse services, skill training to improve parent-child relationships, and referrals for psychological evaluations, outpatient therapy, and other services. HCC takes a holistic approach in addressing needs and removing barriers through a network of community-based programs and services, such as case and care management, counseling and assessment, health education and literacy, transportation, translation services, rural health professional recruitment, ACA Marketplace, Medicaid, Medicare enrollment, LiveWell connectors, student nursing programs, healthcare advocacy initiatives, and health IT. To fulfill our mission, we have created a patient-centered network where none previously existed. Our patient-centered network brings together health, social service, and faith-based community partners to address barriers and identify needs in our community. The Connectors program was established 3 years ago to increase the knowledge and understanding of resources available in the community and surrounding area. The Connectors approach is that there is no wrong door for our patients to knock on. Each connector provides a starting point with access to a plethora of services. The focus of the Connector Group is to build relationships across agency lines, to enhance service delivery to shared customers and patients, assist individuals with scheduling appointments, and to link them to other needed resources. The Connector Group always follows up to ensure the individual's needs were met. Additionally, the Connector Group has developed a comprehensive resource directory and works cooperatively with staff and community organizations through Lunch and Learn monthly meetings. The Connectors have created a new community within our community to help people solve problems requiring big solutions. Project Connect was born out of the Project Homeless Connect model. Connectors reach out to individuals and families who often do not trust government assistance, but who need health, dental, and other social services. By using a cadre of community volunteers who assisted in planning and execution of these one-day free health services, and with HCC as the local sponsor, 4 Connects have been held around Lafayette County in the last year. This event is for adults that are underserved and/or underinsured and serves as a one-stop shop for those in need of being connected to services in their area. Some of the services offered are dental, primarily extractions, free haircuts, birth certificates, ACA registration, referrals to social service providers, registration for food stamps, and supplemental food. Other service organizations also provide information to those in attendance. We also provide follow-up services to ensure the patient's needs have been met, or we make additional referrals. The need for household and personal hygiene products grew as the Project Connects grew. It was important to try and glean products from various vendors to address this need. This gleaning led to the Warehouse Project. The Warehouse Project Coordinator collects donated household and hygiene products, furniture, bedding, and towels, paper products, mobility equipment, and other useful items from businesses, manufacturers, retailers, vendors, and the community. Recently, HCC received approval from the Veterans Administration for the 4 Live Well Community Health Centers to provide medical and dental services to area veterans. This provision of services is called the Veterans Choice Program and allows veterans to access services in their community rather than driving over 40 miles to the nearest VA medical facility. This is the story of the Healthcare Collaborative of Rural Missouri.